Okay, good to go.
Okay. Hi, everyone. Thank you so much for joining this environmental sustainability based training session run through the training seminar series through the BRC training capacity team. My name is NIHR. For those of you who haven't met me, I am a project manager within the BRC for the musculoskeletal diseases team, and also a research fellow at the University of Manchester, and I'm the school sustainability lead. So this session is really about environmental sustainability. It'll be a very general introduction to why sustainability is important to healthcare research and how the Manchester BRC can work together on this, aligning some of the key environmental sustainability strategies within our BRC partner organisations. So I'm going to give two examples of MFT and the university we've been working with currently, and also touching upon the impact of current strategies and reporting impact and some examples to kind of set the scene and get us to start thinking about impact and sustainability within the BRC. So why have I decided to do this? So I've been a postdoc research fellow at the University of Manchester, been a postdoc since 2014. My research is very much lab-based and I've been involved in lab management. So I've seen sort of through that environment how much waste we generate in the lab. And I've always been quite passionate about sustainability anyway. So with the previous Green Impact scheme that was run through the student union, the NUS scheme, I got my lab involved in the Green Impact scheme and we got the gold award in that. And it's very similar to some of the schemes that we will talk about later, where we focus on energy, water waste in the lab and also outside the lab as well. And following on from that, I became the sustainability lead for the School of Biological Sciences at the university. So I work very closely with Dr. Maggie Fostier, who's the Associate Dean for the sustainability within the faculty at the university, and also Dr. Joe Pennock, the Social Responsibility Lead for SBS. I initially started focusing on awareness for LEAF, which is a lab-based framework to mitigate against negative environmental effects in the lab, and I'll talk about that more later on in more detail. But now, given my role in the BRC, I thought I'd like to change my focus to look at sustainability in healthcare research and kind of harmonise and align some of the work that's going on, not just in our organisation at the university, but also in our partner organisations as well. And also some of the work I'm doing supervising undergraduate project students in the environmental sustainability project students, I thought would be quite inspirational in thinking about similar projects within healthcare research as well, perhaps through the undergrad stream, but also within our postdocs and fellows and researchers within the BRC. So just a very high level introduction. I think everyone knows what climate change is, and that affects everyone, whether you work in the office, whether you work in a lab. Everything that we do has an impact on climate change. What's important now is that institutions such as the universities and also funding bodies are being increasingly held accountable to these strategic goals that we have in place within our university. So there's been a concordat for environmental sustainability of research and innovation practice. So we heard about that more last year, and we found out that several funding bodies, including the NIHR, the MRC, had signed this concordat. And what this is important for is creating visible and credible leadership for sustainability at all levels, ensuring that research and innovation is carried out in an environmentally sustainable way, and establishing new ways of working within these institutions and ensuring our net zero targets are met, and also looking at greater reusable products and supporting robust decisions and resourcing. So I delivered this training, slightly different training to the BRC core team last year. So some of these slides might look a bit familiar. At that point, the University of Manchester had not signed this concordat, the NIHR had. now I'm really pleased to say that I think it was late last year, early this year, the university has signed it. So this is gaining more momentum, and it's really important that we take this seriously, because this Concordat is good to get us to start thinking about our strategic goals within the institutions. Every institution has a sustainability plan of sorts, or strategy. So now we're going to be held more accountable for these and what we're doing. So why the BRC? What a great, perfect link between the NHS and academia we've got here in all the work that we do. So I've put some partner institutions there, but then also there's the other NIHR infrastructure as well, the Health Tech Research Centre, the HRC, and others. And I've started making links with a few people from these infrastructures. So following my meeting with the core BRC team last year, I've met Eve Koutadou at the MFT R&I, who's a sustainability lead there, as well as Thomas Bradley, who I hope both of these people have joined the core within the HRC, and also Emma Darlington, who works at the Christie. And we have a shared interest in sustainability and really want to start harmonizing the sustainability work we do and work together without duplicating the initiatives that we do across these institutions. And I think that's where the BRC comes in really well. The other thing about the BRC is that we're always reporting on impact. So I remember listening to a talk about when we first started talking about reporting impact within the BRC, I thought, well, sustainability is a form of impact. We should be looking at that too. So last year for, I think it was for International Women and Girls in Science Day, I wrote a blog through the BRC that was shared on the BRC website. This was very specifically aimed at labs. And this was kind of the first taster into trying to get sustainability within the BRC, getting people involved in LEAF. And I think if we can record how many people take on the LEAF training or training, that's a measure of impact from the start to the end of the BRC. And it's also a great way to start sharing good practice across the different sites, potential for projects, very important for future grants. So thinking about the Concordat, given that the NIHR, MRC and others have signed this, I think in future grant applications, there will be a section where we'll have to address how our research projects, how our studies are being conducted in a sustainable way. So now's the time to really start talking about this within the BRC. I think we're halfway through, and well, I'm starting to hear talks about thinking about the next application. So it would be really great to start thinking about this and how that can be incorporated as well. As I imagine it will be looked at for future applications, and not just NIHR, others too. So the next few slides, I'm going to start talking about the strategies that exist at the institution. So I'm going to focus on the University of Manchester's sustainability strategy and some of the initiatives we have going here. And then also focus on MFT. So this is really a lot of the work that Eve Koutadou has done, and in sort of giving me information about some of the initiatives that are going on there. And then start thinking about how is this relevant to the BRC and how should we start thinking about impact as well. So at the University of Manchester, we have a sustainability strategy known as Our Sustainable Future. So this is from 2023 to 2038. And the direct aim is to be zero direct carbon emissions by 2038 and net zero by 2050. There are several areas of focus here within our strategy. So risk and climate resilience, responsible procurement is a big one, travel and transport, resource management, valuing nature. So there's been a lot of work looking at the green spaces within campus recently, and construction and refurbishment. And importantly, to provide training and educate on causes and impact of climate change and how to mitigate against it. So I think at the moment, we focused a lot on labs, but this affects really everyone, whether you're lab or office-based. There's been a lot of training that's been aimed at the undergraduate students as well, but I know that we have started talking about a training for staff. So the University of Manchester staff who've joined the call may be aware that we've all had to do this essential training that we all have to do, which involve health and safety, unconscious bias and things like that, all very important training. And there are now talks that I'm involved in to do a similar one for sustainability for staff as well. And that will be added to the list, hopefully. So yeah, sorry about that to add to the workload, but we hope to make it simple and not too time consuming. As I said, the initial focus really has been on the labs because that's where the majority of the waste from the universities derives from. So the focus to reduce that consumption and waste and share resources more effectively and develop sustainable protocols has been the real initial aim, especially since Maggie Foti started her position as the faculty dean for sustainability. And it's really, I mean, just to give a few examples, per scientist, we generate 15 times more plastic waste, up to 10 times more energy in waste kind of expended in the lab versus the same office space, and 4 times more water in the lab versus office space that's being consumed. So it's a huge impact, and there's a lot to tackle. And of course, each lab is different as well. So really catering that training to be kind of standardized and harmonized across all labs within the university, but also cater to specific bespoke labs is quite a challenge and takes some time. So there are 2 main tools that have been used to drive this. So the first is LEAF, which was initially set up at UCL, and it's a free certification tool established in 2019, and a bunch of other UK universities have also taken on this framework as well. So there's a bit more harmonization across the UK academic sector, at least for this. Importantly, is evidence-led and not only does it allow the sharing of good practices, publications and guidance, there are also calculators as well where you can actually measure baseline waste and then measure this over a time course. So then it's a good way of recording impact as well, and show how far your lab has come. And essentially there are 3 levels you can apply for. Bronze is the base level, silver and gold, with criteria set around 10 categories, mostly focused on avoiding waste of energy, water, chemicals and consumables, and increasing the recycling range compliance and also repair as well. So all these things not only mitigates against negative environmental effects, but also it saves money as well. And I think that's one of the main kind of drivers in this, especially when a lot of us labs are run on research funding, finite research funding. This is important in multiple ways. The other tool is the 6R. So the 6 R's being review, reduce, review, reduce, reuse, refill, replace, and recycle. I think I'd know how to say it quickly by now. So this was developed in the faculty with a focus on plastics initially, and mostly for the teaching and learning. So this was really to engage within practical classes with the undergraduate students. But now it's also useful for research labs as well to engage staff as well as students. And it's being used for student projects as well, and embedding environmental sustainability within teaching, but also within the labs that the students visit for their projects as well. So the main focus now is getting this into research labs, but also by integrating it into LEAF. So we're working on one tool rather than multiple. And that really has snowballed into something really quite great as well. So when you become a LEAF champion, when you undertake this training, you become this LEAF champion, you join the Faculty Sustainable Lab Network. So we're trying to extend this to MFT staff and beyond as well. I'll talk more about that later, but I have, in that initial blog I mentioned earlier, tried to advertise this. Initially, we provide induction guidance, training, and these green tip slides to be circulated in meetings as well. So these are specifically lab-based guidance to make all lab users aware of how to reduce their waste. We're looking to make this training a recorded resource as well, so it can be circulated more widely across other institutions, hopefully. So these LEAF audits are performed by current champions within the graduate teaching assistants. So it's all very localized. No one external comes in to assess your lab. Once you're audited, you get your award. So whichever one you go for, bronze, silver, or gold. And there's no sort of follow-up at this point, whether you're still doing the things that earned you that award. And I think that's changing now. So there will be follow-up audits to make sure that you're still doing what you said you're doing. And the training is available for all staff through the staff training catalogue as well. If you search LEAF 002, you can log on to the training that way. The faculty target is to have everyone at a bronze award by July 2025, and I'm really pleased to say that the training uptake has been phenomenal over the past sort of 6 months. Loads of labs have taken this on, so it hopefully will meet that target. What I'm also trying to do as well is being part of this network is see how many of these labs are already a BRC lab within the university. So it might be that there are already multiple within the university who are BRC, and it'd be nice to see. That would be a good way of impact, and also something to put into future grant applications. So if you want to say that your lab research is being done sustainably, you can say this is being done in a LEAF accredited silver award, gold award, bronze award lab. And I think that's a positive thing to start thinking about as well. So we'll start recording this information and hopefully record that. This is an example of a green tip slide as well that we share. And I think what's important here, not just for lab-based information, but anything really, is the dissemination of this information. So we have this as a standing item in our lab meetings, and I think a lot of LEAF labs do. And we also have it as a standing item in divisional all staff meetings as well, because I think having that top sign off from the PIs as well and show that they're engaged and know what's going on in this sphere is really important, as it provides kind of motivation for those who want to get involved as well. Because I know we're all busy. People who are involved in this are, there's no one solely working on this. We're researchers, we're peer staff, we're PhD students, we're, professors and lecturers as well, all are working towards this. Everyone can do this, but it's keeping that momentum going and making sure that people are still aware of this. So having this green tip slide, it's all in every lab meeting, keeps it at the forefront of everyone's mind. So that's what we're trying to encourage everyone to do. And these slides are kept in a repository within the Sustainable Labs group. Again, I would like to kind of harmonise this and allow this to be a resource that can be shared wider. So to talk about some of the initiatives that we have in the faculty as well, we have a faculty lab for reuse. I have asked if we can extend this outside of the faculty, but it requires some health and safety sign off, and there are often these barriers as well, especially with lab-based research initiatives, that it does take a bit of time to get the health and safety papers in place to deem it safe to share this, but I'm working on it. I'm not going to give up, and I think it will be a really good resource to share. So this is an example of some of the things you can get on this list currently. We've got these cryogenic freezer boxes, cardboard boxes with lid. I think almost anyone who works in a lab uses a ton of these. So when a lab is clearing out, or if a lab is moving, often these things get kind of catalogued, and I guess in the past got thrown away or just left or dumped, where actually a ton of these can be reused. I actually shared a bunch of boxes myself with the cancer group recently, because we had a bunch going spare, so why not? And there's all sorts on there: pipettes, thermocyclers, pens, even a CD player. Actually, if you're still listening to CDs, it's nice to have one in the lab, I guess. The link is there below for those who are university based to access, and please do. You save a lot of money and you're not letting things go to waste. We've taken on a water bath, I think it was, and a few pipettes when we needed it. It's really good when you're in a pinch and don't want to kind of order something new. Similarly, is furniture for reuse as well. So this is based in the Simon building. So this is for desks, chairs, filing cabinets, all sorts of goodies in there, including stationery as well. You could just turn up, have a look. It's like going to like a mini IKEA, I guess. And I think they do deliveries as well. They'll move it if you're home based. They will take it home for you if you need. The staff who work there are amazing, super friendly, super helpful. They make everything very easy. And actually, I worked with Eve recently. Well, recently, I think it was last year. She had some bookcases that needed rehoming, so the furniture for reuse guys took that. So that was a nice positive there. And we reused items from them when we needed filing cabinets and things. And they make that really easy. And there's a ton there that would otherwise just go to waste. One of the other things, and I guess this kind of links in with the Concordat as well, and the sustainability strategies in terms of procurement, is kind of working with the companies that we order with. So we currently maintain a list, the link is there as well for university staff, of companies that we use a lot in the lab across the faculty. So there's a ton. A couple of examples I wanted to raise are Star Labs. We use a lot of Star Labs pipette tips in our labs across the faculty, and they actually recycle their tip boxes, and this is taken in the lab and recycled at a central point. The Star Labs people take it, and they're also very conscious about changing their consumables to be more recyclable and greener, I guess, and they're really proactive on that. So we do promote Star Labs quite a bit. Also working with Protein Tech, they're a local company that usually sell antibodies, but when they sell, when they're working with them on a scheme to recycle and reuse ice packs, not just those sent by Protein Tech, they're actually happy to take any ice packs. These come in packaging to the lab when we've ordered a reagent that needs to be kept cool. We get these ice packs and then we don't know what to do with them. Officially, at the University of Manchester, if you put them in a bag in your lab, it does get taken by technicians to Stopford stores where they reuse it for their own purposes. But if you have every lab within the faculty bringing their ice packs, multiple ice packs per lab per day to Stopford stores, they have too many to reuse anyway. So that, at least this way they can be recycled and reused by a company, and because they're local, that carbon footprint is minimized as well. So we're looking into that, and there's a ton of other initiatives that different companies do, usually based around their own products, so it can be limited in that sense, but it's worth having a look if you're lab based. And I mentioned undergraduate projects as well. So if you're a bioscience undergraduate student at the University of Manchester, you do have the option of doing an environmental sustainability based project, and this is really driven by Ruth Grady and Maggie Fostier as well. We're constantly collecting ideas that derive from our sustainable labs meetings that we meet regularly, and also when we have one project, it doesn't just end there, right? It informs the next project for the next student, or perhaps researchers in the lab that want to take it on. So some examples of this is looking at freezer temperatures and impact on samples, and this is important for HTA samples and study protocols as well. There's always a big push to increase your freezer temperature from -80 to -70, which is amazing in terms of energy savings for the freezers and for your lab. But how does it affect your samples? Even if they're kept frozen, does it affect different sample types? Will it affect the downstream analysis? The answer is actually probably yeah, from some preliminary information I'm getting from some student projects that are ongoing right now. So this is important for HTA because we're also trying to get some guidance from them about what temperature those freezers should be at. So for those of you who don't know what HTA is, that's the Human Tissue Act. So tissue and samples collected from patient studies, some of them can be HTA relevant, which means that they need to be kind of accounted for and audited on a fairly regular basis to make sure. And part of that is to ensure that not only that the samples are there in place where you said they are, but also that they're being kept at a stable temperature, at an ultra low temperature, and it's monitored constantly. So that's why there's some work going around that, and it's probably relevant to a lot of BRC studies and groups as well. So watch this space. There's going to be some guidance coming out about that, and that's derived from student projects that are ongoing right now. Other thing is testing in more environmentally friendly reagents compared to what we already do. So greening our protocols, we call it. So if there are alternative reagents that claim to be better for the environment, easier to dispose of without any harmful effects or reusable or anything like that, but you don't want to go against what you've already been doing, how is it going to impact your science? This is all very important. Project students can come in and make it their project to test this, compare with data that was produced before, and compare with data that produced using these new reagents and seeing what the effects are. And this has been really good because I think a few reagents have now been replaced and protocols have been changed. I really would love it if we could think about some healthcare project ideas as well. So I'm hoping that this starts getting people thinking about it. And I just want to also plug my own undergraduate PhD undergraduate student who's looking at the impact of cold goods packaging. So she is measuring the impact of expanded polystyrene boxes. We get a ton of those in the lab. What happens to it? How much is reused? How much is recycled? Actually, how good is the recycling? Is that environmentally friendly in itself? It sounds good, but is it always? And also looking at the frozen gel packs and ice packs that get sent in our labs. How many are people getting? And what gets done with these. So that's kind of where this link in with protein tech has come in. We're hoping to be able to reuse these a bit more. And also through Eve, actually, I've linked in with the surgical workshop team at Stopford, who are always needing these ice packs for the cadavers that they use for the medical students. So once you put the word out, you actually find that a lot of people have ideas and uses for these things. And there's real value in networking. That's what I found by doing this. Anyway, so I mentioned Eve, and I wanted to focus on sustainability at MFT, specifically the R&I team. And so since that meeting I had with the core team, I started expanding my network and trying to reach out to people at MFT. And Eve has been absolutely amazing. She's a wonderful woman, so proactive. She's a sustainability lead in R&I, and this is probably even more now. I'm using sort of maybe a year old's information that she gave me, but since November 2022 they've saved more than 33 grand by reusing and redistributing office furniture and other office supplies. And I know she's really interested in the consumable sharing aspect as well. There's a lot that can be done there, but that's a work in progress. And increase the carbon handprint and the positive impact by reducing waste, minimizing reliance on supply chain and transport of goods, raising awareness through networking and staff training. So I'm really hoping that we can carry this on and work towards that together. So since the R&I sustainability team was brought together, they've saved more than 290 tons of carbon dioxide emissions. So that's 7 return trips from Manchester to Sydney flying first class. So just to put a value on it, that's impact in itself. And that's probably outdated impact, actually. It's probably even more now. So I've got the MFT sustainability strategy. I mean, it's so simplified. There's a whole PDF there, but just to really highlight that there's synergy between the University of Manchester and also MFT. Obviously, slightly different things and slightly different environments, being a clinical one, but the goals are all very similar. And I'm going to provide some examples that Eve has given me on some of the initiatives that they're working over at MFT and are creating impact. So one of the things is the couch roll project that Eve has been working on since April 2024. And it involves R&I and non-R&I areas at several MFT sites. And the aim is to measure the reduction in carbon emissions as a direct result of eliminating the use of this couch roll in key outpatient areas across MFT. So this is that kind of tissue that you have on the beds and stuff if you go to clinic. The pilot ran for 6 months with the support of the area leads and infection prevention and control, and now working on consolidating that data using specific tools. And now it's looking like it could be part of NHS England guidance by the end of the year. And it's such a simple guidance for the use of couch roll that can be rolled out to a number of different clinics and institutions across the UK. It's going to be massive impact. So really great to hear about that. Also, Leaf is making its way into NHS labs. So I'm sorry, that's taken from a newsletter, I think, just to show that there are some Leaf representatives. This is at Wythenshawe. But do contact Eve if you're MFT based and want some training. I've got the emails at the end of the presentation anywhere, which will be, the slides will be shared as well. And another example is a qualitative analysis on home care practice in research. So they've identified a list of home care researchers and shaped a questionnaire to gather baseline data on how many studies are utilising an element of home care provision. So this is a kind of a scoping exercise to gauge opinions, experience, any barriers in this initial audit, and then they'll work on that to see how that can be addressed. And this is really cool. This is very important and also very relevant to us in the BRC. Eve is working closely with Thomas Bradley at the Health Tech Research Centre, and I think hopefully Thomas is also on this call, working and with other people on the Sustainability Impact Assessment tool. So this is to gather some broad, high-level data on existing studies across a range of their portfolio related to sustainability practices. Determine how positive or negative the environmental impact of these studies are, and to help identify future areas of focus. And the key thing about this is keeping it simple so that anyone can just working on this project, whether you're a project manager, researcher, clinician, can kind of simply say yes or no when they're setting up the study or assessing current studies. And it's aligning with the MFT and HRC green plans, and also considering the NIHR carbon guidelines, which can be found on their website, and hoping to work with companies. And I'm hoping I can link in with them as well. I've spoken to Eve and Tom separately about this. It'll be good to see if we can get some harmonisation here within Manchester and really lead on this space and get the University of Manchester involved in using this tool as well, and maybe even amending it for non-healthcare related studies within the lab or this kind of research area as well. So I'm very excited to see where this goes, and hopefully we'll hear more about this in the not too distant future. Other training, so we're all talking about net zero carbon emissions, but what does it actually mean? Well, if you actually want to know and be trained, highly recommend attending the carbon literacy training. This is currently run at MFT, so for MFT staff only, and it's an external company that offers this. It's a half a day face-to-face workshop, plus some extra reading across 5 modules. So please do contact Eve if you're interested. We are really looking to see if we can get this over at the University of Manchester as well. We've had some initial conversations with Maggie about this. I think there's some cost implications with it, which might make it a bit trickier, but I'm not going to give up. We should try and, again, harmonise across the institutions, at least within the BRC as well, so we're all reading from the same hymn sheet, so to speak. So now, how do we do this in the BRC? Well, I want to start signposting these initiatives. So this initial training is just really an outline of what we want to achieve. So going forward, I want things to be a bit more specific, I guess, and really finding out what people need. So that's kind of what this training session is for as well, especially in interactive sessions, is where are there gaps? What can we do? So at least in the meantime, we can signpost the initiatives across the partner organisations that we already have. So the first newsletter was sent out late last week, in the form of a newsletter where I've highlighted some upcoming training and some initial initiatives, but I will hopefully update that. Maybe I need to sort of work with the comms team and find out what the regularity of these will be, but hoping it will be useful for everyone in the BRC. And I'll try and keep it mindful as well, not to keep it too lab-based as well. So hopefully by sharing this training and guidance on incorporating sustainability, we can help report this for impact and kind of have a harmonized way of doing this across all our partner institutions within the BRC, even if there are different training that is available for different institutions. I want to make that all kind of visible from one area. We also want to have BRC sustainability champions. So this is someone, hopefully one or two within a theme, within each theme of the BRC. So I think there are 13 themes that can sit in the theme meetings and kind of attend the training, disseminate their information within their theme, and also take on queries and questions and develop that so that the research that's being conducted in the theme can be more sustainable, and also kind of record the current impact of research studies for annual reporting as well. And that shaping policies by reducing waste and energy use. So that's really, the sharing of policies, initiatives will help with that, I'm hoping. And that, so if there's a network, is what I'm envisaging, of BRC sustainability champions, we can meet on a sort of regular basis, come together with kind of key questions and any barriers or any ways of measuring this impact, and kind of come up with a solid method of recording this going forward, and also changing practice maybe, or even highlighting good practice. And it was kind of the first main step of embedding sustainability within BRC research. So if you're interested, please contact Emma Thorpe, and also me as well, and would really like to kind of get this going. Another example working with partners is through Emma. So I'll meet with Eve monthly. Started meeting with Tom as well in the HRC, and also met with Emma Darlington a few times based at the Christie. And currently, Emma's leading on an application to the Greater Manchester Cancer Conference and Awards in November 2025 this year, to deliver a sustainability session at this conference. So it's a cancer research focused conference, but hopefully we can deliver a session around sustainability, not too dissimilar to this, I guess. We can change as we can decide as we get closer to the time. But it's a really nice example of kind of the partner institutions working together for a similar goal. And it'll be good to kind of keep an eye out for other such conferences across the research themes in the BRC, and see if we can kind of do this in other areas. So I'm just thinking, like in rheumatology, might have missed the boat this year for the British Society of Rheumatology conference, but perhaps might be worth thinking about for next year, see if there's anything there. And I'm sure there are other conferences as well in other research areas. And also to kind of get more contacts and expand this network, maybe at NCA, Blackpool, etc., and kind of create a synergy here and work together. And I think that will deliver the greatest impact. So talking about impact, so this next section is really just my initial thoughts, I guess, based on the work I've done in sustainability within my role, and also learning and being part of the BRC and project management. This current BRC is my first experience in project management as well, so it's all kind of still, I can't say it's still new for me, but it is still new for me, I guess, in terms of the skill sets and the things that I do. But I really kind of embrace that and try and see what my initial thoughts are in sort of reporting sustainability impact for kind of annual reporting purposes, etc., and kind of help others as well who might be thinking about this and how do they answer this question for future applications and impact reporting. So again, this is my informal initial thoughts. Happy to take on suggestions and initial thoughts around this. We are working with Maggie at the university and trying to create a bit more, gather information for more formalized training on this as well. But I like to, think, well, why not start thinking about this now? So I just thought I would put together what my initial thoughts were and see what you guys think. So in terms of research impact, we want to see how environmental sustainability considerations and activities positively or negatively impact the wider public, right? That's what we're trying to do. So in terms of BRC focus, what can we think about? Project setup, pre-setup, or even like current projects as well. Consider the study design and areas to focus on there. Lab-based projects, I guess, I don't know if it's because I've worked in the lab, I see it as like quite an easy place to kind of pick these things and report, especially if you're leaf, etc. Procurement, again, it doesn't have to be just lab procurement, it can be procurement of anything. And also patient and public engagement. This is something that we really work well on in the BRC, and there's really areas we can delve into here in terms of sustainability, and also looking at clinical procedures and protocols as well. So in terms of project design, when considering new projects or considering the current projects, are they designed to minimize carbon footprint? Is there anything that can be done? So in terms of pre-setup, it'll be good to get that carbon literacy training in first, and that might help inspire and kind of take on some points when actually setting up the project. In terms of like analysis, the use of AI to improve modeling has been suggested quite a lot. And I think in terms of like saving on resource time and things like that, it can also have a negative impact on sustainability, which is something that I only recently considered, given the large servers that are put in place to power these AI engines, ChatGPT, etc. They use up a lot of resource to keep them cool, etc. I'm still learning about this, but it's important to start considering this in a balancing act, and ensuring consumables the purchased are not wasted, recycled, and reused. So check in with the schemes that I mentioned before in that previous document, but also check in within the environment that you're in within your department. Could you buy something that can be shared across the different research studies so that they're not going to waste, and kind of identify that? Can protocols and consumables be harmonized? So if one project is using a specific type of blood tube, and when you buy these blood tubes, they come in like massive packs of like 500 that people struggle to use all of, can you use that tube in your study? If not, why? Consider that kind of stuff. It saves money and it ensures that it's not wasted as well. In terms of what can be done virtually and brought to the community rather than individuals traveling in. So within the BRC, I've been hearing a lot about the research van, and that could really help in going out to the community, and helps in lots of different ways as well, and kind of affects the carbon footprint of that study, versus having loads of people traveling in to one place. You could go out and access a lot of people in one space, minimizing their travel. And consider the question itself. So areas of respiratory research, I think, lends itself really nicely to sustainability, considering the impact of climate change. And I know that there are existing studies looking at this, the effect of pollution and lung health. Another kind of key NIHR area is adherence. So we always talk about, as we should, adherence in terms of patients and the effect on patients, but also what's happening to the medication that's not being taken, and the waste, the medication waste, and the downstream effects of that. I've heard some pretty scary things about the effect of meds, even that we do take, and when we excrete them, and the wastewater plants don't actually remove that properly from the water, and that has downstream effects on the environment. So things like that to consider. And I know there's some researchers up with NIHR, particularly in anaesthetics. So I don't know if this reached out to Clifford Shelton, if he's on the call, but he's really worked actively in that stream, and hopefully maybe we can get a seminar to hear more about that. So who can be involved? Project managers, study coordinators, PIs, students, anyone who's setting up a project study can think about this kind of thing and be involved and part of that conversation when considering this. In terms of lab-based projects, the easiest thing to do is get that LEAF training and become a LEAF champion, have at least a bronze LEAF award, and don't just stop there. You can then work towards a silver LEAF. My experience with LEAF is bronze award is actually kind of very easy to get if you are a functioning lab. It's mostly health and safety, if anything. So getting that leap to silver is actually quite small. Getting to gold is where the hard work is, because you have to really measure the specific impact for waste. When I mean measure, you have to weigh your waste and your bags of waste. But it's worth it. And it's also impact that can be recorded if you can say that you've reduced lab waste by X amount of kilos, or increased your recyclable waste by X amount of kilos in a given time frame. That can be reported on as positive impact. And also can minimizing the use of single-use plastics if you've identified companies that are better for that kind of consumable. That can be recorded as well, and also shared so other people know that they can use that too for their work. Reusing and recycling lab equipment. How much have you procured from the Lab for Reuse scheme? Or I know, as I say, MFT is working on something similar as well. And if you do have leftovers in various kits, there are schemes where this gets sent off to international areas where these kind of things are harder to get hold of. So I think it was Emma Darlington who told me a lot about that, something that they do over at the Christie. And consider existing protocols. Are there green alternatives that need testing? Again, let me know. This could be tested as part of a student project at some point, or it could be a researcher's project as well within the BRC. And I think we can find ways within doing a student project if we can badge that as BRC as well, but that's conversations we can have if something comes out of that. Again, lab managers, study coordinators, PIs, researchers, students, anyone who's working in the lab or involved in the lab can be part of this conversation. Going on to procurement, this really goes hand in hand with study design. If you're setting up a study, you know what you need to buy to conduct this research, then now's the time to start thinking about which companies to order from. Are some more sustainable than others? Ordering the right amount for your study, and if there's too much for a particular study, check within your teams, as I mentioned before. So we share our blood tubes across all our different patient studies that are based at the Kelvin Centre, so that's at the MRI, and that's sort of helping mitigate against that waste. And you can calculate what's been shared and reused to mitigate against waste, and also calculate that impact. So again, project managers, study coordinators, PIs, researchers, students can be involved in this. And in the BRC, we have a great resource for patient and public engagement. And I think what would be really, really good will be to incorporate this into PPI events to get the patient perspective on this, especially since we have links to such diverse communities who are really willing to talk about research and give their opinion so willingly. And especially those who experience health inequalities, it'll be really good to see where they think this sits, because it's really important to consider their priorities as well, which will be different. And I think it's really important that we embed that in our thinking and in the training that we do as well. It's all very well me saying we should do this, we should do that, let's reduce this and let's reduce that, but we also have to consider the impact on patients and the different communities as well, and how they'll be affected by this. And there are ways that even I don't know really yet. So would love to be kind of part of these conversations with the public to see what their feelings are, and provide. And it's also an example, a kind of an opportunity for us to provide examples and also receive their feedback on what we're doing. So again, everyone can be involved here. In all of this, taking part in PPI events. So we should all really be involved in that, as my feeling. And clinical practice and protocol change, so influencing guidelines and have major impact. The Couch Roll project is a good example of this, I think, and consider applications to other things as well, the PPI and surgical instruments, etc. Protocol templates for newer studies, so sustainability is harmonised, and link in with other NHS trusts and share protocols and see if that can be embedded in more detail. This is an area that I am less familiar with, as you probably could tell by how quickly I went through that slide, but it's something that I would love to talk more about and link in with project managers, research nurses, clinical staff and PIs. So you probably noticed that the moral of that story is that everyone can be involved in this. I guess the point is how, and that's kind of what I want to get from the next part of the session, is to gauge what your thoughts are on this, and kind of within your role as well. Like, if you want to be involved, how can you be involved, and how can we, and for us to kind of take that on board and shape future training as well. It is really difficult, and I think barriers I faced as well, that I have an idea, I really want to take it forward, and then there's other things to consider, usually health and safety. But that shouldn't stop you either. It's about having those conversations and seeing how we can make things safer, or providing guidance to everyone. And so this session, really, I want to be a bit of a scoping exercise. So you've heard me whispering on for ages, so I apologise for that. I think you all need a break from my voice. So grab a brew, and also grab a piece of paper, because, and I'll tell you later, because I'd want you to, it's something big enough, but not too large. It doesn't have to be an A4 piece of paper, something to write a short statement on. And if you're happy to, hold it up to the camera at the end, and all will be revealed later. I don't know if people want to.
It just goes to show how much we can all achieve. We all come together. So my name is Ivka. I'm the Estates and Facilities Officer and the Sustainability Lead for Research and Innovation. I work across different sites within MFT, but I've come to know NIHR and the team a little bit sort of more closely, and I do wish to carry on this collaboration, because there's so much we can achieve just by brainstorming, working together, exchanging experiences, knowledge, and a passion for sustainability. So thank you for having me here today.
Right. So, I mean, I've introduced myself, hopefully that was clear, but I don't know if we just go around the room. If people are back. Tom? Oh, Emma?
I'll go next. Can you hear me?
Yeah.
Yeah. Hi, everyone. My name's Emma Mystery. I'm the BRC Operational Performance Lead. My role is more or less around the contractual side of reporting back to the NIHR, around objectives as well as finances as well. But I think as Nisha has alluded to, it's kind of becoming a bit more flavour of the month within the NIHR is sustainability. And as we start to look at our midpoint review and looking forward into the next application, obviously this is going to become more of the forefront of our bid going forward, and we need to really consider measures of how we take this into consideration as well. I think obviously with it being NIHR at University of Manchester and EVA, MFT, those are our host partner organisations. So it's important that we do work together and then bring in our partner organisations as well thereafter. So it's kind of like walking before we can run, essentially, and trying to see those similarities, because there's going to be overlapping kind of like pillars that you've both identified in your strategies individually, that we can work together. But I think from our perspective as Manchester, I think it'd be really important, obviously as part of our contract, is that we need to report back on case of impact. And I know that word has been heavily used throughout this presentation, and I think I mentioned it in the comments, and it's about demonstrating the impact from a measurable perspective as well, and how that's improving kind of like our population and our patients as well across Manchester and our workforce as well. So it's important that we do trend that as accurately as possible to demonstrate that impact going forward. So yeah, and then we can obviously submit that to the NIHR hopefully in the near future, and start showing that Manchester is starting to be one step ahead, essentially, ahead of the next application. So yeah.
Thanks, Emma. I've just put some of those notes into the Padlet, and everyone else can please feel free to add to that through the link as well. Next we have Kat.
Hi, I'm Kath Wright. I'm the Programme Manager for the Hearing Health theme of the BRC, and also Cluster Manager for the Under Research Conditions. Yeah, I've really enjoyed the session so far. I think from my perspective, people are interested in doing something but don't really know where or how to get started. So I think having some some guidelines and some sort of easy to follow instructions, whatever, would be really helpful. Yeah.
Thanks, Kath. I'm just writing that down as we speak. But yeah, that's really important. Thank you. Anyone else back? Tom Bradley? If not, Annie Samuel? Oh.
Hi. I'm Annie Samuel. I'm one of the research nurses, and this is the first time I've come to this session, and it's been eye-opening to me, and I've never thought about these stuff, but I think it's going to be helpful.
Thanks, Annie.
Thank you.
There's a great deal we can do with work. We've worked with our own research nurses within the RMD theme in kind of sharing, I mentioned the blood tubes and stuff. So it's
I'm very new to research. I've just started like 4 months ago, and the topic is so new to me, but I got to know so much today. Thank you, guys. Thanks.
Pleased to hear that. Thanks, Annie. Jennifer Soren, are you there?
Yes, sorry, I was trying to unmute myself. Hi, I'm a research nurse. I work in MRI, and it was very handy for me to hear many things, how we can reuse things, because we do get a lot of things from the study team, and sadly, sometimes we have to dispose without using it, and it's very painful to see let go things. But from today's presentation, like how we can reuse things, it's a very nice presentation, and it's an eye-opening. Thank you.
Thank you. That's really great to hear. We can hopefully think about other opportunities, like knowing if you're not sure if something can be reused, it would be good to know, either to get back to either me or Eve and see where we can work on that, and if we can identify streams to actually reuse that and see if there's a wider need for it as well. So
yes, I know Eve, she always comes to a collaborative team to ask, if we need anything, we are like, Eve, we need this, we need that. So in terms of furnitures, it's very handy. We are able to get things, but the tube bottles, and in past we have discarded many things which we are not able to reuse for the other studies, but it will be good that we can reuse and save some money, and we can save our environment, isn't it?
I'm working with our sustainability team, the MFT sustainability team at the moment, because we need to have a very specific process in place when we repurpose clinical items. So it could be, I don't know, blood taking devices, needles, for example. So we have come up with the process. I'm in the process of drawing up a map as to what we can use in terms of in-date consumables, or what do we do with expired consumables. So it is new to everybody. I'm working with our NHS supply chain head of for the trust, and also the MFT procurement matron, Marie Green, and the MFT sustainability team. So it is coming. I know it's quite slow in the way it has kind of unfolded, the whole process, but we need to make sure that if we do go down this route, we will not be putting anyone at risk, including our staff, with reusing, repurposing items, and of course keeping our patients safe as well. So it is a process, but we hopefully we are making steps towards the right direction.
No, thank you. For example, if we have got a lot of stuff and which can be reusable in other studies, so whom are we supposed to approach to give out things?
Okay, so I have a spreadsheet. I have a database that I will be asking my key contacts in the first instance to populate, send it back to me. That will be checked by myself, by the NHS supply chain lead, and also Marie Green. So just bear with us for now, because we're still kind of trying to look at who the right people will be involved and then approve. If you could, I think for now, if you could just take a a photo maybe
Okay.
of the item, the expiry date, and just send me an email.
Okay.
And then I can see if I can try and expedite the process as much as I can.
Thank you very much. Thank you.
The impact in progress, actions from this meeting. Great. So I see Thomas. Tom, you're here now. Would you like to introduce yourself?
Well, thanks, Nisha. Hi, yep. So as Nisha mentioned, I'm Tom. So I work for the NIHR Health Tech Research Centre, which is another piece of research infrastructure within MFT. I will say a lot smaller than the BRC, but I am the sustainability lead for the HRC, and I also work quite closely with Eve in the MFT sustainability team.
Thank you. So Emma Darlington, are you here?
Hello, yes, I'm here. Hi all. Sorry, I am not ignoring the camera prompts. I've not got a camera on this computer, so I apologise. But hi, I'm Emma Darlington. So I'm a research manager. I'm based in the early phase trials team at the Christie. So the Christie does have sort of a sustainability lead based within the trust, but the sort of research element of that was really lacking. So that's where I've tried to, just purely out of interest and wanting to get something done, I've set up a trial sustainability working group, and we're working on some things such as reuse initiatives. We've developed a tool for measuring impact. We're sort of looking at how we can liaise now with sponsors to improve what they're sending to us to improve, because we're sort of held tight by sponsors really on how much we can actually get done as a trust. So yeah, that's me.
That's great, Emma. I just wondered, have you chatted to Tom and Eve about the impact toolkit? Because I know that's something that they're
not so much yet. So myself and Eve, we have met, haven't we? It was a few months ago now, though, really. But yeah, I think I was listening before, and I think I'll get in touch with Eve for another call.
Please do. Yes, absolutely. Let's get
Definitely.
together.
I think we can link together for sure.
Fantastic. I know Hema was saying before that the word impact's been used a lot, and that is on purpose. It's to really drill down. The other word that I've used a lot is harmonization, and that is also on purpose because it would be really great to kind of share that practice so we have common toolkits used where possible within everywhere, really, to make it easier. So then we can all help each other as well if we're all looking at the same sort of thing. But obviously, there will be things that we'll need to, I'm sure, tweak and change between different areas for sure. Thanks, Emma. Bindu, are you there?
Yes, hi. My name is Bindu Xavier, and I'm one of the Agile research nurses working at the RRDN, NIHR based at City Labs. And yeah, the session has been really interesting because I feel that we do waste a lot in research, especially with all the, even with all the printing of paper that we do, like, for participants or, and we at the RRDN, we have different events regularly, like trying to promote research throughout the communities. And of course, we have to, print out a lot of posters and stuff like that. So there are things that we can't, sort of reduce. But in our team, we've started sending more, like participant information leaflets as an email to participants who can, use email rather than posting out, about 17 sheets of, participant information leaflets to each participant. So yeah, we've got to try our best, isn't it? So yeah. And the session, gave a few more sort of, areas that we could look at. So yeah, thank you very much.
Thanks so much, Bindu. Yeah, use of paper again is I know some areas is really hard to kind of reduce, but where you can and where you've made that change is something that we should be taking note of. And also, I guess, getting information from the participants if this is better for them or if there are any barriers to that. It's good things to record and try and change. The other thing as well, I guess, is if we're using electronic health records as well, that's also a move towards better sustainable practice as well, rather than relying on paper records. So great, thank you.
Cheers.
So next I have Alice Copson.
Hi, I'm Alice. I'm a PhD student at the University of Manchester, but I'm based at the Christie as well. And I'm looking into the environmental impact of breast cancer screening. Yeah, it's just been super interesting to meet all of you and to hear about all the projects you guys are looking into. Yeah, I think the bedrolls one was especially interesting to me. Yeah, and I'd love to hear more about that. But yeah, I mostly just came along just to meet you guys and yeah, hear about what's kind of going on. So thank you.
That's so interesting, Alice. So that's the title of your PhD is Environmental Impact on Breast Cancer Screening. Is that right?
Understanding the economic and environmental impact of breast screening. Yeah.
Fantastic. Which year are you in?
I'm just the first year so far.
Right. So you're setting out your objectives and
doing my literature review at the moment.
Awesome. Well, hopefully, maybe further down your PhD route, I would love to hear from you and what you're finding. That's so interesting and completely within the remit of what we're seeking to do here. That's so great. So
yeah, I'd be happy to.
Fantastic. You'll keep in touch and good luck with your PhD. Great work.
Thank you.
And Donna, I think. If you're there, Donna.
Hi, my name's Donna Grimm. I'm a medical oncology consultant and I work with Emma in the Christie in the early phase trials setting, really on the work about sustainability and developing the Treetops toolkit.
Thanks, Donna. It's nice to see such kind of diverse roles in this group as well. We've got students, research nurses, project managers, and it's certain consultants and research. It's just this is exactly kind of what I wanted to kind of gauge from this discussion and session. So the next thing, I guess, we've touched upon it already, but it's kind of what areas would you like more training in, or kind of where do you feel the gaps are? So just put your hand up and chip in terms of environmental sustainability. Like as Hema said, this is it's becoming flavor of the month, and we need to start thinking ahead of the game, and also like it's important anyway outside of research, just in life. This is an important thing to consider that we should be working on. But in terms of, and I know Kath mentioned it as well, and others in terms of guidance and things, it's such a massive area, and we're all working in different areas and different themes. So I guess one of the things I wanted out of the session is for everyone to make a personal pledge about what they would do, a small action or a pledge towards an environmentally sustainable action. So I guess my pledge and action, hopefully, out of this discussion would be that the next training I give will incorporate one or more aspects of what is kind of mentioned by you guys in terms of what you need. So to do that, I guess you guys need to tell me what do we need to work on, because such a wide area. It would be nice to focus on each thing with a bit more kind of focus and resource. Which will also mean that I need to do some reading upon it, because I'm not in any way an expert in this area. So please do put your hand up, don't be shy, let me know. Or you can put it in the Padlet as well, the link as well. The link will be active for some time. I'm going to leave it up so you can come after the session. If you think of ideas, pop it on there, because I'm going to be using that as a base. Eve.
Right, so this is something that we did discuss, you and I, at NIHR in the past. Ice packs. I think that's going to be something that I would love to investigate a little bit more. because I know that we do get a lot of interest from our clinical teams and research teams. We do end up with a lot of ice packs. So I know you mentioned a company called Protein Tech.
Yeah.
So more for me and less for you, but I have an action for you. If you don't mind, just sending me any contact details, because I know that you said you're going to look into it in more detail. But it might be worth potentially, if you do arrange a meeting with a company, maybe I can tag along. So we, and then we can divide and conquer. But I think in the first instance, just to try and understand what their processes are, so they can take all that back into our own processes. And I don't know if there's any SOPs we need to draft, what the paperwork is like in the MFT. But definitely, because I had to throw away a lot of ice packs. They do come in boxes, they do come in crates, they do come in bags. So if there's a way for us to repurpose internally, we can investigate that as well. But I mean, if they're interested in getting all these, and you mentioned they're a local company as well.
Yeah, they're based in Manchester.
So that's even better. And obviously there's, the logistics we need to consider if they do charge for collections or what have you. But yeah, please, that's my pledge looking into the next kind of mini project for me.
Potentially, I could complete that pledge for you if you're free tomorrow at 10 o'clock.
I'm off tomorrow and Thursday, back in next week. So,
okay.
Yeah.
All right. Well, in which case, so tomorrow I'm meeting with Jess from Protein Tech. So she.
Oh, you're meeting them. Okay.
Yes, but it will be an initial meeting. So it's I can ask her to meet again, actually, and we'll maybe virtually this time, and if that's more easier, with you as well, and see, because I've got some ideas in terms of logistics within the university side, but that's obviously going to be different for you. But they're really keen to kind of get going with this, and as far as they're concerned, they'll take any ice pack. Doesn't have to be a Protein Tech one. I sent them a bunch of pictures of what we have. And they're like, yeah, we'll take it all. Just needs to be not contaminated, which by and large they're not.
Yes, of course they wouldn't be, because if they get delivered to me to either repurpose or get rid, then obviously they shouldn't be. Brilliant. Yeah, let us know, and then we can have a follow-up meeting after your introductory one. That would be amazing.
Excellent. Okay, cool. I will do that. Thanks, Eve.
It might be good to go around and see if anyone else has got any pledges from what they've heard today, or any questions that they want kind of from the session as well. My pledge is to share as much of the training as far and wide with BRC staff and students as well, and whatever's available currently in the toolkits. I think that's really keen to just kind of let people digest and kind of see where they're at, how they can incorporate it, and yeah, just kind of embed that into work kind of from as early as possible. I'm sure people are currently doing it in some ways, but it's how they can kind of embed it in their usual practice.
Exactly. That's great. Thanks, Dave.
I'm just going
to next. Oh, Jennifer, hi.
So, hi, I'm just going to give awareness in our team, and I will share to other teams as well, as because we have got 3 teams in this office. So how we can reuse and whom we can approach to give back certain things which it's not been used.
Thank you.
That's great.
Donna?
Yeah, I think our focus has really been physical waste, and that's kind of been a lot of the issues, because some of the things in clinical trials that have been done previously. Sorry, I missed a lot of the session earlier. I was interviewing, so but has been to do with carbon footprint, whereas what we're seeing is just lots of physical waste that we had accumulating around the office. Emma's done a fantastic job on kind of categorizing that, looking at tools, sort of auditing it, and then looking at tools to, I suppose, to try to work out kind of how wasteful particular trials are, or particular sites are. And we've got some things that are sort of in manuscript form, hopefully, that we can circulate as well. So I think probably trying to progress those and continue to work towards reducing clinical waste. But I think actually Emma's probably driving more of that than I am.
Is that Emma Thorpe or which Emma?
No, Emma
sorry?
Darlington, who's on
Emma
the call as
sorry.
well.
Yeah, sorry. Yeah, that's great. Thank you, Donna.
Amazing. Thank you, Donna.
Yeah, I guess I'll go. Thank you for that, Donna. Yeah, good coverage. Yeah, I guess my thing is just going back to the training. I think from my point of view, especially for staff like myself who have a really keen interest in getting involved and wanting to do something, it is that where to start with it. I feel that there is a real lack of training in how to do it. So I guess part of my pledge is to spread a bit of awareness that it can be done, even if it's just small steps, like what we've done with some of our kit reuse and recycling work. It's just sharing that with other teams and other staff in similar groups, just to show what can be done, and also to look at some of the training and maybe push the trust. Because I was looking before, I think someone mentioned about the NHS sustainable training. I think MFT have the face-to-face session. We don't have anything like that here at the Christie. We have some available online, but it's certainly not mandatory or essential. I don't know whether there's any measures of who's done it. So yeah, I think I'll become a bit of a voice piece for maybe saying that needs to be done and to empower staff to actually make change. That's me.
Thanks, Emma. Yeah, that would be great. I think awareness and sharing and training seems to be the key thing here. Oh gosh, I'm going to mute myself because the fire alarm's.
Cass, would you like to go next? Or I don't think Alice has gone. Feel free to chip in, whoever hasn't.
Okay, I think I might go next. So I think a couple of actions kind of linked to what people have said. So as NIHR has mentioned around impact assessment, so that's something that we are now piloting at MFT, and that's actually been led by one of our colleagues in the corporate team. So that's still something that is very much in its kind of beta version at the moment, but it links with our Trust Green Plan. And it's the idea is that it's like a 10-minute risk assessment for every kind of research projects, but also just any kind of projects in general. And it's to do like a kind of snapshot of the sustainability impacts of any kind of new activity that we're doing. So our objective really is to pilot that and hopefully find a way to implement it, in a workable and practical way into our processes. And the idea is that we can use that to get some data on particular areas or focus points where we can start to focus on where we can make some impact. And then another point which I would like to mention, which again kind of links to what other people have said on this call, is the point around training. So as NIHR mentioned, within the MFT, we've got our carbon literacy for healthcare training. So for any colleagues within MFT, that is available for them to undertake, and we would encourage people to sign up. There is actually some other training for MFT staff online on the Collidus Learning Hub, which is a bit quicker and easier to access than the carbon literacy training if you just want to do something quick. There's about a half-hour module available on Collidus, but there are actually some free national level training resources again for NHS associated staff. So I've put in a link there to the environmentally sustainable healthcare e-learning module, which is designed by NHS England, and that's another online module that people might want to undertake if they're looking to increase their knowledge in that area. Thanks.
Tom, that's great. Kath, did you want to go next?
Yeah, can do. I think an action for me is to actually find out what, if anything, is happening in our area, because I'm not actually aware of anything. And that doesn't mean to say that there might not be things going on. I mean, there seems to be a lot more focus for the wet labs. And in hearing health, we have hearing labs, which are full of equipment, but they're not the sort of traditional wet lab environment. But And we have a group of research audiologists who sort of support the equipment and the research projects taking place there. So I think there probably is quite a lot of stuff that we could be doing. And I know that I know within our school we do have sustainability reps, but I don't remember anything being fed back to us as to what we can do. So I think it is just actually trying to find out what's happening and join the dots a bit, really. And what I was saying about guidance, I put it in the chat earlier. I think sort of one of the things is that sort of, you were saying about I never say the word, the purchasing things. We have to order from the people on the catalogue already, which and I have no idea whether those companies are sustainable or not sustainable. So, I don't know how easy it is, but maybe sort of even just sort of taking a small sample of things that lots of people are likely to use, or certain companies that are used a lot across the board, and some guidance as to whether they're sustainable or not. And also, I don't know, I'm not clear, how are we measuring that somebody's more sustainable than another company? It's those kind of things just kind of feel a bit vague to me at the moment.
Yeah, it's a really good point. I mean, we hear about companies like greenwashing as well, saying that they're doing something and it's not quite accurate. So there's a lot of work to do that. In terms of, I know in terms of the lab side of things for the university, they're working a lot on the procurement and sustainable companies and what they're doing, what they're retaking back, and the kind of products they're using. But there's more to that than procurement, isn't there? So there's it'd be good to kind of work on that actually. Thanks, Kat. Eve, I know you got your hand up.
I just wanted to, because I know that if, Kath, if you've never been involved in any sustainability pilots, I think it can get overwhelming, just to try and understand, what's going on, how to measure things, what to measure. So you should have contacts through your estates and facilities team. And I know that it has been done in other sort of lab areas, because I know that you mentioned your specialized equipment. There's always a way to measure and monitor your existing power output. So that could be a good starting point to see whether your existing equipment, is as green as it should be, how much energy it's using. So there are tools to measure. I know that because my husband, he's an energy engineer, so he always comes home with different kinds of gadgets. So there is a way for you to gain some baseline data. So it might be worth you linking the first instance with if there is a sustainability lead in your area, with them, and also with your estates and facilities contact. And that should be your first starting point, because they might already have that preliminary data. So it might just well be for you to get that, understand your current usage, and then look into ways for reducing that if possible.
Sounds great. Thanks, Eve. Not sure where we got to actually. Does anyone else have any?
I know that quite a few training has been put into the chat, so it'd be great to kind of bring all that together and share it with all attendees, plus wider kind of next newsletters, etc. I think that'd be really useful. So yeah, feel free to send all that over, or Nisha, if you want to kind of bring it together, whichever's best.
Absolutely. So I think I mentioned the BRC newsletter before. I want to keep this going, and I'll be doing another one probably in a couple of months or something after annual reporting is a bit more calmer. And one of the things I want to put in there is just feedback from this session as well. So I don't know, Jane, I'm sure there are feedback surveys and things that will be sent out, but also please do keep putting points on the Padlet, and I'll consolidate that as kind of key learning points from the session and also kind of commit to my pledge and come up with the next sort of training session around that. It was nice to get this engagement today and really want to build on that and really appreciate you all coming today. It's been really nice and positive.
Nisha, just a quick point. So at the Christie, we seem to receive some BRC newsletters, but I didn't receive yours, and I've just messaged Donna, and I don't think she did either. So would you mind sending it on to me, and I can circulate it within the Christie? But
yeah, of course.
I'll just check what mailing list we seem to be on, because we mustn't be on all of them, just to make sure it's getting to all the right places, because I think it'd be really interesting to look at.
I will do. So I think because this is kind of something that I've kind of cobbled together in this first bit to gauge interest. So it's not gone through like the official BRC
right,
comms,
yeah.
because they're really busy right now as well. So what I've done is shared it with team managers and for them to circulate. And I did that on the Friday to kind of avoid clashing with the other kind of comm stuff going through as well. So what I might do is have a separate list with project managers, and I'll add you to it as well, Emma, specifically for disseminating the
great.
sustainability newsletter. So
thank you.
Thanks, Emma. That's great. Okay. Any final thoughts? Otherwise, I can get you 20 minutes back before lunch. Brilliant. Well, thanks everyone. It's been really great and really appreciate your input and your thoughts and comments on this. It's been super positive, and keep your eye out. There'll be more to come in the future. So yeah, I think Jane, you can let people know about how to get hold of all the recordings and things, right?
Yeah, the recording will be shared on the BRC website in the coming days. We'll obviously share the presentation and any useful links as a starter. I think that'd be great. Thank you so much. Well done, Nisha, and thank you everyone for joining today. Look out for future sessions as well. And yeah, I think maybe signing up to the specific sustainability mailing list would be a good start as well.
Thanks all. See you all around.
Thank you.
Thank you.
Thank you.
Bye.
Thank you.